Welcome to Review Central. This is NCLEX Reviewer number 6, featuring questions on psychosocial integrity. This reviewer is intended for those who are eyeing, or are set to take either the NCLEX-PN or the NCLEX-RN. There are 10 questions featured on this reviewer. All questions are modeled on actual questions that appeared on previous NCLEX exams. Let's begin. Question number 1. Which of the following is true of gabapentin as a treatment for migraine headaches? A. It has a half-life compatible with daily dosing. B. Dizziness and somnolence are the most common side effects. C. It is a proven prophylactic agent for patients with migraine headaches. D. It should not be used in conjunction with valproic sodium if this combination will increase the risk of liver failure. The correct answer is B. Dizziness and somnolence are the most common side effects. The half-life of gabapentin is 5 to 7 hours, thus requiring multiple doses per day for full-day coverage. The most common side effects of gabapentin include drowsiness and somnolence. Gabapentin is renally excreted, without any liver metabolism, and hence will not increase the risk of liver failure if used with valproic sodium. Question number 2. Which is most important in patient education for someone who is about to undergo rhinoplasty? A. Facial care following surgery. B. Physiologic adaptation. C. Body image changes. D. Health promotion and maintenance. The correct answer is C. Body image changes. Counseling on body image changes is necessary before rhinoplasty. Physiologic adaptation is needed for patients who have major surgery. Question number 3. Since major depression tends to occur during the childbearing years, which is not true? A. For patients with a history of severe chronic depression, rates of relapse are high if medication is discontinued. B. Monoamine oxidase inhibitors are associated with fetal anomalies and are contraindicated during pregnancy. C. SSRIs are the most common medications used during pregnancy. D. Tricyclic antidepressants pose potential teratogenic risks. The correct answer is D. That tricyclic antidepressants pose potential teratogenic risks is not true. Fluoxetine, sertraline, fluvoxamine, citalopram, and escitalopram are SSRIs that are pregnancy category C. Paroxetine is category D. Question number 4. Which of the following is true regarding bulimia? A. With bulimia the weight may be normal. B. Psychiatric comorbidities occur rarely with bulimia. C. Bulimia nervosa classically results in dramatic weight loss. D. Bulimia nervosa is more common in males than females. The correct answer is A. With bulimia, weight may be in the normal range. The hallmark is binge eating with compensatory behaviors to prevent weight gain, for example, laxatives and induced vomiting. Psychiatric comorbidities are very common with bulimia. Question number 5. Which of the following medications is least likely to affect balance or stability? A. Antibiotics. B. Antidepressants. C. Antihypertensives. D. Sleep medications. The correct answer is A. Antibiotics. Antibiotics, except for aminoglycosides, are unlikely to affect balance. Other medications that can affect balance include antipsychotics, diuretics, seizure medications, sedatives, alcohol, and aspirin. Question number 6. It was determined by behavioral studies that there are 5 stages which the patient goes through to achieve cessation of smoking. What number is the preparation stage? A. Second stage. B. Third stage. C. Fourth stage. D. Fifth stage. The correct answer is B. Third stage. The first stage is pre-contemplation, in which the smoker considers possible reasons to stop in the foreseeable future. The second stage is contemplation, in which the future changes to now. The third stage is preparation, which involves determining which techniques, possible medications, and support will be needed to achieve the cessation of tobacco. The fourth stage is action, which is actively entering the process to end smoking. The fifth stage is maintenance, that starts after 6 months and establishes how the patient will continue to avoid the nicotine habit. Question number 7. What is the best treatment for trichotillomania? A. Avoiding hairstyles that place traction on the hair. B. Topical corticosteroids. C. Behavior modification. D. SSRIs. The correct answer is C. Behavior modification. Trichotillomania is an impulse control disorder where the patient pulls out his or her own hair. Behavior modification and support groups are basic treatment. N-acetylcysteine, dronabinol, olanzapine have been used but are not indicated for this condition. SSRIs have shown minimal benefit. Question number 8. A 17-year-old is having nightmares, sleep disturbance, memory lapses, and anger following an MBA in which several friends were killed. What is the condition? A. Post-traumatic stress disorder. B. Panic attack. C. Paranoia. D. Phobia. The correct answer is A. Post-traumatic stress disorder. Post-traumatic stress disorder, or PTSD, is a severe mental disorder that develops after exposure to an event or events with psychological trauma. Symptoms involve intrusive thoughts which are frightening, anger, aggression, loss of empathy, inability to recall parts of the traumatic past, irritability, sleep disturbance, depression, and avoidance of thoughts that lead to distressing memories. Question number 9. Which of the following is not part of the diagnostic criteria for schizophrenia? A. Hallucinations. B. Negative symptoms. C. Disorganized speech. D. Substance abuse. The correct answer is D. Diagnostic criteria for schizophrenia does not include substance abuse. The criteria cannot be secondary to a substance. There is debate as to whether cannabis can cause schizophrenia as a long-term consequence. Question number 10. Which of the following applies to the term veracity? A. Accuracy and precision. B. Adherence to the truth. C. Conformity to fact or truth. D. All of the above. The correct answer is D. All of the above. Veracity is adherence to the truth. Veracity is conformity to fact or truth. Veracity is accuracy and precision. You have just completed NCLEX Reviewer number 6, which featured questions on psychosocial integrity. If you wish to watch more NCLEX reviewers on psychosocial integrity, check out our NCLEX Psychosocial Integrity Reviewers playlist. Check out also our other NCLEX playlists for other reviewer topics. If you haven't done so yet, please don't forget to subscribe to Review Central and click or press the bell button to make sure you get notified whenever we post a new reviewer or other review materials on this channel. Please like if you find this video useful and feel free to share to anyone who may also benefit from it. We wish you all the best on your forthcoming NCLEX.